This latest development comes after the former mayor of Windhoek and AR activist, Dr. Jab Amupanda, posted a video that went viral on social media showing dilapidated parts of the Katutura hospital. I'm now joined this evening by the Minister of Health and Social Services, Dr. Kalumbi Shangula, to talk to us about the hospital's current condition and the way forward. Dr. Shangula, good evening. Thank you so much for joining us here on the Daily Roundup.
Good evening, and it's my pleasure.
Dr. Shangula, this dilapidated state of the Katutura hospital goes as far back as 2008, maybe even earlier than that. But what has now triggered this reaction to urgently renovate the hospital?
Yeah, first of all, I want to correct the perception and the characterization of the Katutura hospital as a dilapidated hospital. That characterization is not correct. There are parts of the hospital, which is a very big hospital, which are in a state of disrepair. But the majority, the overall biggest part of the hospital is in a very good working condition. A lot of renovation has been done over the years. And even this year, we took occupation of 92 bed wards, which was newly renovated. And that part, you cannot call it by any means as a dilapidated hospital. There is part of the hospital from the 8th floor which are made up of gypsum, and now when the water runs through those gypsum, they expand and they become bed, and they need to be repaired. Now, if you may remember, during my budget statement early this year in April, I announced an amount of 500 million Namibia dollar for the renovation of health facilities throughout the country. We have 35 hospitals, district hospital, 3 intermediate hospitals, 1 national referral hospital, and a number of health centers and clinics. They equally need attention. So we are not only running Katutura Hospital, we are running a whole country. The part currently, as we are talking, the whole casualty department is under renovation. There is no, the construction work is going on, and if you just pass the Katutura Hospital, even from outside, you can already see the rubble which has been taken out and is being revamped. This construction started about more than two months ago, and we expect the work to be completed somewhere in October.
You mentioned earlier that there are parts of the hospital that have received renovations, and it's not the entire hospital that is in a critical state. When last was renovations done at the Katutura Hospital?
Every year there is a renovation being done at Katutura Hospital. But as I said, the hospital is very big, and you cannot do the renovation at one time. So parts of the hospitals are being renovated on a yearly basis. Every year we make budget to renovate part of Katutura Hospital and also other hospitals, even Windhoek Central Hospital, Keetmanshoop Hospital, Katima Mulilo Hospital, Shakati Hospital, you can name it, Wolf's Bay Hospitals, Swakopmund Hospitals. There are renovation work going on Anjope Hospital. So throughout the year, we take a part of Katutura, which is being renovated. And then I just mentioned about the 92 ward, which was just occupied this year. So after renovation. And you can go there, you can look at it, you can satisfy yourself. But as I said, that part where the material is made of gypsum, not concrete wall, is gypsum. It's not strong. That need to be repaired. Coming back to the amount of money which I mentioned, so it is being apportioned to different hospitals for renovation, including Katutura Hospital.
How much would each hospital be apportioned, you know, in terms of figures for renovations?
Well, it does not go to say that we equally divide among different hospitals. We look at which hospital has the biggest need, and what is the scope of work. And on that basis, the money is apportioned. Now, the part of the gypsum which I just mentioned, that is due for renovation. It was renovated 8 years ago, but it's again in need of renovation. Now, the renovation, let me take you through the steps of how renovation is done in public facilities. First of all, there is needs assessment to say, okay, this part needs to be renovated. And then you then say, what is the scope of work which needs to be done? What exactly needs to be done to that particular part of the hospital? And then, of course, people who are competent, who are trained to the renovation, who resort under the Ministry of Works and Transport, will then assess and do the documentation. Now, from the documentation, it is included the scope of work, and then also the bills of quantity, to say, if we have to renovate this room, we are going to do A, B, C, D. Now, how much is that going to cost? And that, on that basis, the budget is allocated when there is a bill of quantity. Now, after that, obviously, it will then have to go to the Central Procurement Board for them to advertise. It's a competitive bidding, and then adjudicate, and then a successful bidder will then be given the job. And then after that, the site is handed over to the successful bidder, and then the renovation work will start. So that is how renovation is being done. And of course, it is given that this scope of work demand may be 4 weeks, or 12 weeks, or 3 months, whatever. And the contractor is bound by that time framework. If he is not able to finish, then of course there will be penalty. Yeah, so in order to prevent the dragging on of the work, there is a specific period allocated to a specific job, and the contractor has to comply with that.
You mentioned earlier that there's been renovations done every year at the Katutura Hospital. So even in the thick of COVID-19 during 2020 and 2021, when a lot of, the budget allocated for the health sector had to go to managing the COVID-19 pandemic, there were still renovations done at the hospital?
Well, there was a time where there was a lockdown and curfews, and there was a time when construction work throughout the country came to an end. So the construction sector is one of those which was heavily affected by COVID-19, because you cannot have people gather together when the regulations say that only 10 people may gather at one particular time. So basically, the regulation make it impossible for any construction work to go on. But when there was a relaxation of the regulations, some construction work started, and that's why we were able to renovate a number of facilities so that they are repurposed to cater for COVID-19. And also new structures, what we call isolation, were constructed also during COVID. But it was during that time when the regulations were able to allow for people to be able to be together and for some activities to take place.
Upon your inspection visit to the hospital, apart from the findings that a large portion of the hospital is made out of gypsum walls that would need replacement at some point in time, what were some of your other findings?
I'm not quite sure whether I got the question correctly. You are referring to the fact that what did I find at the Katutura hospital?
Correct.
Well, it does not necessarily need to be me. There are managers at the hospital, and there are people who are responsible for facility planning and facility development, infrastructure development. They bear the most responsible to go and assess, because people, the users, they identify the need to say, well, there is a problem here. And then the infrastructure division will take it up. And then that's how they connect to the Ministry of Works for expert services in terms of assessing the scope of work, determining the bills of quantity, make up the documentation with specification for advertisement through the Central Procurement Board.
Dr. Shangula, can you tell us if there have been any cleaning operations targeting specifically this rodent population in the hospital? And while we're at it, what health risks do these rodents pose to human beings?
Well, they are big risk. Nobody would want to be with them. They are not like cats and dogs, which we keep as pets. They are a nuisance, so to say, and nobody would like to be closer to them. So they are actually enemies, so to say. But it's true, they do come into health facilities. Just like in any environment where there are items which attract them, they will come. And in the hospital, sometimes, unfortunately, there are those conditions which attracts them to the hospitals. This is the leftover food. Now, it is a very delicate situation. When a person is sick, sometimes he does not have a desire to eat. Well, the hospital may provide food. It might be in the locker. And of course, those rodents, they can smell from far, so they will come for that food. Or the food is brought from home. The same thing happened. Now, there is a way to do away with it, with the rodents. Number one, to eliminate the possibility of having ever food in the wards. But that's theoretically is good, but look, a human being needs to eat. And when you're sick, you may not eat everything. Some will be left, and that attract. There is another mechanical way of killing the rodent, by fumigating. Now, fumigating is good to get rid of rodents, but they are also not good for the patients. So it's not something you can say you can do every day. It also affects the patients, because those are chemicals, and you don't need those chemicals in the hospital. So what normally happens is periodically you are forced to do that at the inconvenience of the patient. Yeah, but that's the only way. But there are also some other means where you can place some chemicals at certain strategic positions, which actually repel the rodents. Yeah, but I must say it's a very delicate issue.
Yeah,
it has been dealt with over many years, but I really look forward to the day when we can say that this is no longer a problem.
Yeah.
But it can only be if there is nothing in the wards which attracts them, and they're basically looking for food.
From everything you've mentioned thus far in our conversation, from what I understand, that yes, the hospital does need renovation, but it will have to be done in stages, as it can't all be done at once. You mentioned that the casualty ward is currently under reconstruction or renovation. Talk to us about how long, you know, this process might take and when it will end, and also during the time that it's being renovated, what are the mechanisms that have been put in place with specific focus on the patients?
Yes, a very good question. You see, when you also plan on the renovation of the hospital, you must also think about the patients. You have, where are you going, what is going to happen to the patients? You cannot close the hospital because patient will always be there. So what you do is that you plan the timing of the renovation and also the relocations of the patients. Now, the casualty currently, which is under renovation, part, the OPD, which was there, has been shifted to another place which was recently renovated. It was renovated recently and now is being used as a OPD. And then also some part have been moved into other part of the hospital. It is not convenient, but it's a necessity so that the casualty can be freed of people so that the renovation can take place. So that is how the renovation is being done at all the hospitals. Tackle one part, but make sure that you have a provision for the patients because you cannot close the hospital.
Dr. Shangula, we are at the end of our conversation, but perhaps final remarks you'd like to leave us with on this matter.
Yes, I would like to state that, you know, a health service is a joint responsibility. We say prevention is better than cure. So the primary responsibility for individual health rests with an individual. We are there to give you ideas on how to promote your health and how to prevent infections. We give out these messages so that we reduce the number of people who need to come to the hospital. At the same time, we know that not all conditions are amenable to prevention. Say, for example, a person got a headache, a person got high blood pressure, a person got diabetes. You cannot always say that it is because of the fault of the individual. It's something which has to be there. Or a person contract TB or have a diarrheal disease. So the need for the hospital, despite all the efforts for prevention, there will be always conditions which are not amenable to prevention and need to be treated in the hospital. Therefore, let us look at it that it's not just the responsibility of the government. It is our common responsibility. First, prevention, and then when a person gets sick, must immediately come to the hospital. We are there, our staff is ready to attend to those people. The issue of maintenance is very important for us. And we are doing that. And for example, whatever is there, it's planned as to when it can be addressed. But as I mentioned, the country is big, we have many hospitals, and we are making the best with the funds which are available at any particular time.
Dr. Kalumbi Shangula, thank you so much for your time, and thank you for joining us this evening on the Daily Roundup.
I'm happy to be able to explain to the public how things work. Thank you very much for the platform.